Namaste. I'm Dr. Chaitra S Niranthara. I'm an obstetrician and gynecologist from Chandray Rheumatology and Immunology Center. Today, on the 4th of March, we kind of bring awareness about a very important health issues that most of the women predominantly are facing in our country: obesity. Somewhere between 2019 to 2021, the statistic says that 1 in every 8 women can have obesity. Obesity, what is obesity? Why is it given so much of importance? Obesity is accumulation of more calories in your body. Now, when we say, how do you calculate? How do I know that I am obese? Obesity is calculated by calculating the body mass index. We say a person will be overweight when it is somewhere between 25 to 29.9. And obesity per se is when it is 30 or above. So what does this give an idea about? Obesity kind of gives us an idea about how healthy a person is. Being a gynecologist, I'll predominantly be concentrating on what are the health issues that we women face with obesity and overweight. First and foremost, most of them ask, what are the causes of this obesity or overweight? Why am I putting on weight, madam? Very frankly, it depends on the age and at which phase of her cycle is she in. Most commonly, it is the environmental lifestyle that the person adopts. Apart from that, when they ask me, madam, what could be the cause? Am I prone to develop obesity? Well, multiple factors kind of contribute to it. First of which can be a family history. If there is a significant family history of obesity in the family, the mother and father has obesity, yes, that definitely can play a very vital role. Multiple studies have been done which shows that there is genetical association for obesity. The second of which can be the lifestyle. And nowadays, the obesity, the childhood obesity predominantly is on a very high curve. That is because of the lifestyle, the restricted physical activity. Some particular areas do have a higher prevalence of obesity. If we say it will be around in African Americans or Latins, and bisexual women are found to be slightly on the higher weight side. Particular features will definitely be concentrated on when we talk about obesity, be it genetics. As I already said, multiple studies have proven that there is genetical association. It can be metabolism. Some of them say, madam, my friend eats so much, but still she's on the leaner side. Why do I put on weight even if I have very small portion of food? Well, metabolism. When the metabolism is poor, the accumulation of calories kind of increases. Age. Yes, there are particular age groups in which women are more prone to developing overweight and obesity, like say in menopause. Menopause, predominantly because of the hormonal changes that a woman is undergoing, she is definitely at a higher risk of developing overweight or obesity. Trauma. If they've recently had a surgery or they've had a accident, road traffic accident for which she's had a surgery, long term, if they have to be restricted to the bed, yes, that itself could be one of the cause for overweight. Certain medications also has a role to play in overweight and obesity, like say in when there is an increased blood pressure. In these kind of people also obesity is more common. Diabetes, people who have sleep disturbances, they are more prone for developing obesity. Now, particularly, what are the problems that can develop when there is obesity? This can be for both. Predominantly, the first and foremost features what you start noticing when the BMI kind of increases, you kind of get lethargic to cope up with even day-to-day physical activity. Some of them develop breathing difficulties. Diabetes. Most of them say, please, don't put on weight, you will develop diabetes or hypertension. So diabetes, increased blood pressure, cholesterol. It also kind of increases the chance of having a heart attack or a stroke. Some particular kind of cancers are also common when there is obesity. It can be, say, a colon cancer, or in women, sometimes it kind of also triggers of the ovarian cancer, endometrial cancer. So in particularly, if we have to talk about women, Now, since that is our topic of the day, nowadays, as you see, there is a lot of girls kind of developing a condition called polycystic ovarian syndrome, and I'm sure most of you must have heard about it. Polycystic ovarian syndrome is I can say it's a metabolic condition where the ovaries develop a lot of small cysts. These cysts are going to be fluid filled. Now, why does PCOS develop? Who are prone for developing PCOS? In the US, an extensive study was performed over a duration of 9 to 10 years, which showed that 80% of the girls who were overweight and obese developed PCOS or polycystic ovarian syndrome. We see an association of somewhere between 40 to 80% in our country associated with obesity and overweight. These kind of girls, yes, they are prone for developing polycystic ovarian syndrome. Now, according to the criteria, they used to say one of the two of the three, if they're present, they'll be termed as polycystic ovarian syndrome. Commonly, what are the features that they see? In PCOS or PCOD, what we see will be oligomenorrhea, we'll say, or an ovulatory cycle, or amenorrhea. Amenorrhea means absence of cycles for a long duration of time. Oligo means the cycles kind of doesn't come regularly, doesn't come once in 30 days. It can prolong to 2 months once, 3 months once. So the frequency at which the cycle comes kind of depletes. Next one will be hyperandrogen. This particular feature we can see by clinical examination of the girl or by doing blood test. When I say clinical examination, what we will be looking at will be for hirsutism, the excessive facial hair. The second of which will be the biochemical test or the blood test. In these also we can prove that there is hyperandrogen features. The others, another particular features to say that she is PCOS will be scan. In a scan, we notice that there are changes in the ovary. I just told you all, in the ovaries, there will be small follicles which will be filled with fluid. So on scan, we will see a pattern of arrangement of these follicles. So that two of these three features, if present, we will term it as polycystic ovarian syndrome. It is a very common condition that girls are facing these days. Say around 5 to 7 years back, they say 1 in 3 girls are prone to developing polycystic ovarian syndrome. But as and when it is progressing, we are seeing that the incidence of polycystic ovarian syndrome is on the rise. In polycystic ovarian syndrome, there's another peculiar feature which we say as insulin resistance. So it is a common finding in polycystic ovarian syndrome. It is independent of obesity. It is not that in obesity it will happen, but an obese person will worsen the condition of insulin resistance. And we always tell our patients, obesity and PCOS. If obesity is increasing, PCOS also will increase, because it is adding on to the metabolic hormonal changes which leads to development of these polycystic ovaries. So very importantly for girls especially, maintaining the weight becomes very important. There is no particular age. Leading a healthy lifestyle, having a good diet kind of really makes an impact. Every time you visit a doctor with, say, cycles being irregular, madam, my cycles are not being regular, I'm getting cycles once in 3 months, and sometimes without the help of medication, I am not getting cycles. She will definitely counsel you. She will do a thorough, complete clinical examination. She may investigate you by doing a few hormonal tests, and she will perform a scan. If it is proven that it is polycystic ovarian syndrome, then what we do is immediately in the first thing that we always suggest will be lifestyle modification. In this, we suggest them to go for a very strict diet and have a good physical activity, because by itself, we see a lot of changes. When only that doesn't work is when we go into the medical management. Per se, why does obesity lead to an ovulatory cycle, and why does it develop PCOS? As I already said, the hormonal changes, the insulin resistance in polycystic ovaries, when the small follicles develop, a healthy oocyte which can form an embryo is not released. So because of this, there is no cycles, and when the egg doesn't come out, the chances of pregnancy is not there. So by reducing obesity, you will improve the ovarian environment. By felicitating, you will enhance the production of these oocytes. So apart from this, we also say that by this, in this obesity, especially a girl with type 2 diabetes and obesity, it's not a very good combination. It kind of worsens the polycystic ovarian syndrome. When the doctor is investigating you, she will also make sure that she will investigate you for thyroid levels. Hyperthyroid can also lead to obesity, and the obesity which it develops is extremely resistant and it is difficult to reduce. So there you should be on your toes, and the amount of effort the patient will have to put in is definitely more. There are multiple studies which says that a combination of PCOS, obesity, and hypothyroid can lead to infertility. As I already mentioned, it is because the oocyte is not being released. Importantly, not just polycystic ovarian syndrome, women with polycystic ovarian syndrome and obesity are more prone to developing type 2 diabetes later on. So later on in life, when I say, it could be as and when the age is advancing. And second thing is, if a girl with obesity and hypothyroid and polycystic ovarian syndrome is treated by, say, ovulation induction, and she conceives, she will be at a risk of developing gestational diabetes, that is, diabetes in pregnancy. So the root cause just comes to, again, obesity. Obesity is one of the causes why polycystic ovarian syndrome is formed. This by itself leads to infertility. And so treating the primary cause, which is the obesity, reduces the chances of developing polycystic ovarian syndrome. Also, it reduces infertility. So in short, if I have to say, I would really like to tell my girls, especially the teenage girls, the college-going girls, and the high school girls, it is essential for you to be physically fit. It does not have to be going to the gym. You can do a strict routine of 45 minutes of walk. You can hit the gym. You can do aerobics or yoga. You need to keep the physical activity going. In that way, you can maintain your weight. In that way, you will prevent polycystic ovarian syndrome. This diet has its own importance. As such, in polycystic ovarian, we will do tell them that there is a very strict diet that you will have to follow, which will help you to reduce the symptoms of polycystic ovarian syndrome, also to reduce the amount of follicles in the ovary. Thank you.